Hey guys, this is Dr. Hub. Today we'll look at the Colles fractures and their complications. To start off with, it is the joint stiffness. So that is the finger stiffness is the most common complication. So it mainly affects the fingers. Finger stiffness is very common. And also the wrist, elbow and the shoulder are the other joints which become stiff. So it also involves the presence of the wrist, the elbow as well as the shoulder. Next is the presence of the malunion. Malunion is the second most common. So malunion. So malunion is nothing but the second MC, that is the most common complication, and it leads to something known as a dinner fork deformity. So it forms the dinner fork deformity. And then there is the Sudex osteodystrophy. So Sudex osteodystrophy. So or the reflex sympathetic dystrophy. So reflex sympathetic dystrophy. Then the Colles fracture, it is the most common cause of the Colles fracture. It is the most common cause of the Sudex dystrophy in the upper limb. Sudex dystrophy of the upper limb. And there is a rupture of the extensor pollicis longus tendon. Other complication is that there can be a rupture, and this is of the extensor pollicis longus tendon. And there can also be the carpal instability. Then comes the triangular fibrocartilage complex. Triangular fibrocartilage complex. So this injury is seen. And also the subluxation of the inferior radioulnar joint. So there is subluxation of the inferior radioulnar joint. Radioulnar joint. Next is there may be presence of the delayed union and the non-union. So there can be the delayed union or the non-union. So they are extremely rare. To learn and grow daily like this, please do subscribe.